but I would love to invite Dr. Geller here to talk about some specific medical problems that result from this and some of the treatment experiences that he's had with obesity. Thank you.
Hello, everyone. I'm going to see if I can figure this out. I just lasered the computer. All right, we're on our way. Is it okay if we have a little bit of fun? Yeah. Okay, fun is good. That means I'll call on some of you and we'll do some things like that. That's fun for me. So the people sitting down in particular like to be called on? Okay, if you like it, I'll do that. That's fine. So initially I thought that this was going to be a presentation on pediatrics, but now I'm quickly realizing that we could be talking about adults and pediatrics together. I'm a family doctor. I work in Lawrence, Massachusetts. I'm really proud to see some people here who have come from Massachusetts and are now in nursing school. It really makes me very proud to see you here, so thanks for coming. We run the largest group visit program in the country. I come from Massachusetts, up in Lawrence. There we go. We have multiple effects here. Unfortunately, we're the poorest city in New England. We fight with Holyoke for this. This year we won. But Holyoke has the highest teen pregnancy rate, so that's the bigger prize usually, unfortunately. So we have 38 weekly group visits. Group visits, I don't know if you're familiar with what they are. I like to think they're part of the future of medicine. This is kind of a group visit if we decide to share all the information that we know. Jennifer, that was amazing. You covered so much so quickly. Whoa. But one thing you mentioned that I thought was really cool was that it's really a small change each day, 138 calories, that seems to be the problem that's causing obesity. And whether it's coming from watching too much TV or eating too much soda or food, or the stress associated with not burning off calories or lowering metabolism, that means that maybe a small change can fix the problems too. So I like to think that we do have a viable solution for obesity. Okay, who am I kidding? Something that I think really helps a lot of kids with obesity. I come from Lawrence, so when you mentioned that 44% of the kids in Lawrence are overweight, I feel it's like 80% of the kids I see. And then kids who are referred to our programs, it's 100%. So knowing the barriers that exist really give a different perspective to obesity, because you're right, a lot of people in Massachusetts look at their people and say, we're not overweight, but we are. So let me tell you how I got started in being involved in obesity, because really I don't care too much about obesity. There, I've said it. I'm a specialist in loneliness. And so I started doing groups for patients in Lawrence, people without insurance, when it was still legal not to have insurance. Now it's illegal, so not only do you not have insurance, but you're breaking the law. And they were meeting in a library and doing crafts, and one of them was my patient, and she looked pretty healthy, but she was overweight, Latino woman, and said, hey, can you come and talk to this group of women about health? You're a doctor. And I was younger then, so I said, sure, no problem. That'll be fun. And we didn't talk about things other than hemorrhoids and the stuff that people really want to hear about when they talk about health. But what I noticed is that the women in these groups were so much healthier than the people I was seeing in my practice. It was obvious because they had support. They had one another. Those of you who are learning nursing are doing it together. Those of you who are here working at the college are doing that together. You have the support of one another. But in a medical visit, often things were one-on-one. Well, to shorten the story, to move along quickly, to really enjoy my full 20 minutes, I would say that it led to research on loneliness, CDC grant funding where we studied loneliness. What was the intervention if you're lonely? Bringing people together, right? With things in common too, right? So we brought people with diabetes together just to try and treat their loneliness. So we talked, and then we decided what we would do. And this is the neatest thing. We lowered their loneliness and we lowered their depression, but people also lost weight. Their diabetes was much better controlled. And the funny thing is, right down the hall from me, someone was studying interventions for diabetes and weight loss. And we beat them, not even trying. And so then, as a doctor, I can bill for talking to people about being overweight. So that's part of what I can do for a living. And so I started doing that. And I could prove that what I was doing was working in the group visit. So this became a sustainable model. And now I'm going to start talking fast, so I know you're used to that. So you're still startled that overweight is not caused by just too much TV and drinking too much soda. It's more than that, right? Okay. This is our team. This is who we work with. I'm noticing now that the pictures are larger in this font, so that's fine. There are 7 physicians now doing group visits, and I trained most of them. And this is our staff. So what are group medical visits? Well, normal doctor sees a patient one at a time, right? And I see the patients kind of all together. We're all at the same table. So here's a better metaphor. I like this because it's fall still. Is it still fall, technically? Okay. This is well, sorry, that wasn't the pointer, was it? Here we go. Pointer. That's the forest, right? And that's what I see. And then this is a close-up, right? So I love this metaphor. Like, I knew swine flu hit Lawrence about a week ago. I knew it dead on. My group sizes shrunk. Everyone in the group was asking about swine flu. That's what we talked about in our obesity groups, swine flu. You lose about 2 or 3 pounds if you get swine flu. I didn't see that on your slide, because that would make it the most effective, because there's a little nausea with the swine flu. But it made it very easy for me to see why some kids are failing. You have some hyperactive boys running around in a group, and some boys not hyperactive running around, and you kind of say, wow, look at all these. It would be really hard for them to have any control. They're dependent on the environment, these kids. All right, enough about me. Now I'm laser tagging. So wealthy people live longer than poor people. Okay. What does that mean? Ooh, who am I going to call on? Scary. So I'm a doctor, right? And I know wealthy people live longer than poor people, so I have to get them jobs, right? Basically, in Lawrence, you live 15 years less than someone in Andover. If you correct for all the stuff that happens in Lawrence, because that has to be corrected for. Otherwise, it's even worse. You know, you get rid of the murders and things like that. So, okay, that would be the most effective thing I could do to help people be healthier, would be get them a job. Depression is the biggest comorbidity in chronic disease. So if I want to know if my diabetic's going to be alive next year, I would not study their, do you know the tests that you do for diabetics? Like a hemoglobin A1C or their weight? The best predictor is actually their level of depression. If I want to know if they're going to have renal failure down the road, I would want to know how depressed they are. Is it because the depression causes it or because their lifestyle changes? I mean, I'm not going to equate it other than an association. But these things are important. And then I'm kind of concerned because the rest of my slide isn't going to fit on this screen. But who should I call on? You look very comfortable down there with the hat. That'd be the one with the hat. How long do you think you're going to live?
I don't know, hopefully until I graduate.
Does anyone have a better answer than that? No, just think, you know, throw out a number. Think, you know.
I'd say 78.
78. Who can beat him? Yep. How long do you think you're going to live? 90. Okay. So there's no single test that we can do also that's better than that to figure out how long you're going to live. Provided you look pretty intelligent, though pretty relaxed. Yeah. Right? So my job as a doctor might be to get the people who come into my office, my patients say they're going to live till 60. Right? I'm looking at someone who I know knows our patients. 65, then it's gravy. So they're planning their lives perhaps accordingly. Okay, let's see what we get next. So the revelation, I've already shared it with you. If you're going to be an effective physician, especially working with children, and I think I'm going to focus on children, it has very little to do with the medicines itself, okay, and a lot to do with empowerment within a community. And I think that's what a lot of our speakers are going to be talking about today. If we can prepare children to contribute to society, be happier, teach them how to have healthy relationships, and then empower them to actually change these barriers that exist in their communities, we probably would have a better chance of treating their obesity. Put another way, empowerment is the ability to try new things. If you're failing in any way, whether it be with pain or obesity, this doesn't have to really focus on obesity. Something needs to change. Well, if you're not able to try new things, you can't change. There are barriers to trying new things. Some in Lawrence, where I work, there are probably more barriers than in other communities. There are economical barriers. So these barriers are, to me, what causes obesity. Causes suffering, okay? Not everyone who's overweight is suffering, and not all obesity, I think, is bad for you. But there are economical pressures. A lot of the parents work late at night, third shifts, right? So they get home, they're tired, they're sleeping in the home, the kid can't go out and play, whether or not it was safe outside. Kids are buying school lunches, which in Lawrence, they aren't that healthy. I've seen them. We can't afford a nutritionist. Can't afford a good lunch. There are social problems. I think it's a paucity of adult role models. I also teach in the high school. I'm teaching a health class, just a little bit. And you see right away that you spend any time with kids, they do better. And if you talk to educators, one of the things that's key to education is just having a kid who sees someone that they believe can do it, that's like them. So I may not be the best role model for a Latina girl, actually. I can maybe help a boy, or a tall boy, maybe with a ponytail, because they may relate to me. And then if I care about them, there's a really good chance that they'll do well. Latinos are like chubby babies, flat out. Change that. Good luck. I don't know. I know why, actually. It probably relates to where people come from, and in a country where there may not be enough food. If you have a baby that looks nice and chubby, they're going to live better. But we kind of know that chubby babies become chubby kids, and then chubby kids can become overweight adults, and you saw all the risks associated with that. Physical limitations. Are there safe places to play? In Lawrence, there really aren't, particularly as soon as it gets dark. So these are the real things that we have to overcome. You can't just tell kids, therefore, go eat pomegranates, they're healthy. Not in Lawrence. Maybe not anywhere, unless you really have spent the time to build a relationship with them where they trust you, where they believe you, and then they can actually do it. They have the money, they sell pomegranates, and Lawrence has one supermarket. 100,000 people. Andover has 4 supermarkets. 15,000 people. It's a money issue, it's not too complicated, but it's unfortunate. So now that I've depressed you all, we actually are making a lot of progress with something called an empowerment model. And I know there are a lot of ideas of empowerment, but what we do is we bring the kids together and we work on building relationships with them. We have successful experiences in their lives by having them try new things so that they become kids who don't fail high school, have trouble with their parents, get in bad relationships. Instead, they start having positive momentum towards feeling healthier so that they feel a self-confidence. The funk model, I just like the word funk, basically. But funk music is how you feel when you listen to it. Don't ever listen to the words. Don't make any sense. Well, kids can't be completely empowered. So if I'm going to focus on pediatric obesity, I really can't say, hey boys, what do you want to do today?